the lessons and experience gained so that we can be able to help our people. Having said that, and having learned the lessons from the experience in West Africa, there are some things that we must do as a country. And to start with, we must realize, appreciate, and understand that managing an outbreak is a joint effort. It's not a government affair only. It's not a health worker affair only. It's not for the public only. It's all of us coming together against this enemy called coronavirus disease. And basically, mitigation of any outbreak must have an understanding of all of us. And we must understand at this time, we are in a situation like a time of war. And the enemy is only one. And having said this, I especially want to talk to Kenyans. It's not time to doubt the directives from the Ministry of Health. And it's not time to ignore them because they are so important. And the worst thing is that the ignorance of the same will only be realized later when we are in a situation like Italy is finding itself in right now. So that is why, as a union, we have decided it's not time to shift blames and to talk to each other. It's time to sit and talk with each other because we all have the responsibility together to be able to come and defeat this outbreak that we are having. I also want to thank the President and the Ministry of Health because of the social distancing that they invoked, they have effected. And if you look at other cases, if you look at the Ebola transmission, if you look at the outbreak that has spiraled out of COVID, you will understand the importance of social distancing, which usually works to slow down the spread of the virus. Because one thing that we must understand about corona, and maybe I can be able to give you a background on coronaviruses. Right now we have about 7 coronaviruses with us. We had 4 that every one of you and myself here, we have actually suffered from, but we got a cold and recovered from it without even knowing. But then, around 2002, there was a coronavirus, a new one like this one, called SARS, the severe acute respiratory syndrome that started still in China. About 10 years or more later, around 2012-2014, in Saudi Arabia, then we got another new coronavirus called MERS, Middle East Respiratory Syndrome. Now, 10 years later, we have the novel coronavirus. So you can see there is a trend that after a decade or so, we are getting a new virus. And so I think we should come to understand that these are things that in future we may still have to deal with. And it's not a new thing. So this corona, because most of the Kenyans are wondering, why are we told to wash our hands? If we get it from somebody coughing, why are we washing our hands? And I think the biggest gap we are having right now as a country is civic education. And we are taking the role as health workers. And I want to urge the administrators, the ministry, the management of health across the board, please do not gag health workers from giving civic education to Kenyans. But I also want to urge my fellow health workers, do not give the education in a way that probably may cause panic. Because we need to come together to educate Kenyans so that they understand what we are dealing with. The other day, last Sunday, I decided to take a walk around a market somewhere. And I just wanted to understand if Kenyans are understanding the gravity of the issue at hand. And I decided to ask some hawkers. Now that you are selling so many things to our kids, and the government said that you need to sanitize your hands, and so that we also don't probably exchange notes and such, so that we limit the spread. Why aren't you using them? And 90% were like, are you serious? You believe these stories? So there is a gap, and some Kenyans do not believe that coronavirus is real. And we want to tell them that corona is here with us. The problem with corona is not the deadliness or the fatness that many people will die. Because we have seen with this outbreak from the previous cases in other countries, only maybe a few, and the elderly, and those who are immunocompromised and with other conditions are actually dying from it. About 80% will get a mild illness that may probably not necessitate even hospitalization. About 10 to 20% might get the severe illness, with less than 10% requiring maybe ICU care. So what it is telling you, the biggest problem is not that it will kill more. In fact, the mass corona kills more than this novel coronavirus. But the biggest problem we have is that it's highly contagious. The infectivity is very high. And when the infectivity is very high, it means so many people will get sick. When so many people get sick and they go to hospital, there might not be enough resources, enough hospitals to hold them. And that is the lesson we are learning from Italy. Italy did not institute decisive measures like we have seen with our government at the onset. And what happened with a country with the best, the top-notch health system, with everything, the one that you can actually emulate, is going down with coronavirus. And why? Because the cases of corona have spiraled out of control, and the people requiring hospitalization are more than the hospitals can hold. So that is the problem with corona. And what we are trying to achieve, what the government is also trying to achieve, when we tell you to wash your hands, so that, as my GS said, whenever you are holding the microphone you are holding and somebody else is holding, if they had coughed into their hands, they transmit it, because you get it in your hands, from the doorknobs, from the lift, from a table like this, from a paper like this. So what you need to do to cut this transmission is then to either wash your hands with soap and water. And by the way, if there is invention, the biggest invention that helped control diseases in this world, it's the invention of soap. Soap and water will protect you from 80% of viruses and bacteria that you have in the environment. If you cannot get water to hand wash, then use your sanitizer and use it well. And ensure when you are using your sanitizer that it is more than 70% of alcohol. I don't know if you can be able to zoom into this. I hope there is no brand name anywhere, but this side there is no brand name. You can see my sanitizer is 70% of alcohol, and that is what is required to be able to kill this. Sorry? So that is what is required so that you can be able to kill this. So what we need to do as a country, because I remember we were saying it was a matter of when and not if coronavirus was to come into Kenya. What we need to do for now is to slow the spread. The spread will be there, but we must slow it such that our hospitals can accommodate those who are going to require hospitalization. But if we do not adhere to the very simple rules that are, and let me assure you that there is nothing the government or the health workers can do to check this if the public do not adhere. Because I've been to social places, I've been to some places where there are gatherings and they are not washing hands, they are not sanitizing. If Kenyans do not adhere to the simple measures that we are taking to ensure that we slow the spread of coronavirus, we might not be able to handle this. So Kenyans must understand that they are the ones, they have the biggest role that will ensure that we are able to mitigate this. If you look at China, because China being the source of the virus, you understand that because of the strict measures they took, the social distancing, they went into a total lockdown. It has actually slowed the transmission, and I think now we are even getting less than 15 cases from China. And actually now the epicenter is coming from Europe. And it's because the measures they took, because of the understanding of the public, owning up and knowing that they are the ones that can be able to mitigate this. Then as health workers, and I want to quote the General Secretary for WHO, any mitigation of an outbreak starts with a health worker, because it's a health worker that will give this health education to the public so that they can understand. It's this health worker who will be able to single you out when you have the symptoms, and then we can be able to test you. And it is the same health worker who will be able to treat you so that, and to even isolate you so that you are no longer spreading the virus out there. So we must build confidence in health workers. And how do we do this? Building confidence in the health worker means that we train them, and more importantly, we train them very well on the protective measures put in place so that they feel confident that with the protective measures in place, they can be able to actually manage this suspect or a confirmed case without actually getting infected themselves. It must start with the health work. And that is why we are asking that we are taking a collaborative approach. By the way, even in the US, there is no country that has ever been 100% prepared for any outbreak. But we must come together, and that is why we are saying as a union, we have decided we are not going to play the blame games. We are going to collaborate with the government. And I want to make a clarion call to the CS Health, and I want to thank him because he is very proactive, and we can all see that he is not reserving any efforts to ensure that we can be able to mitigate this. And the county governors, that we need to work with the leadership of the health workers so that we can be able to fast-track trainings, we can be able to bring out gaps wherever they are, and we can be able to close them. And so that health workers can feel confident that the protective measures that have been put in place are actually enough, and they feel confident that these measures are actually going to help them. Lastly, let me say this, and I still want to quote the General Secretary for WHO. The biggest enemy that we are having right now is not coronavirus. It is the fear and panic. It is the rumors and the fake news we are having. And it's the stigma we are starting to develop against the suspected coronavirus patients. And the only way we can be able to fight this, the only way we can be able to stand together, is by understanding the facts. And that is why we are saying, even as the fourth estate, please look for health workers so that they can give Kenyans this health education, civic education, to get an understanding why they have a role to play. That is why we are saying we get the facts. Once they understand the facts, everybody will play their role. Number two, let us invoke reason instead of fear. Let us stand in solidarity. And solidarity means it's not time to second doubt. It's time to understand the directives that are being given. It's time to understand the measures that are being given. And it's time to encourage every one of us to be able to utilize those measures so that together we can mitigate this. And there is something very funny I've found. I live in Kitengela, and on Sunday, I went through all the supermarkets and chemists trying to get a sanitizer. People have bought all of them and they are stockpiling them in their homes. They have even bought the surgical masks and you can no longer find them in chemists. Kenyans, you don't need to wear a mask. The only person who needs a mask is a person with respiratory symptoms. And even if you come to the facility, we'll be able to give you. But please, if you have traveled or have come into contact with somebody suspected to have coronavirus and you feel you have symptoms, before you come to hospital, the best thing would be call us. We will come for you. Because when you bring yourself to hospital and you have symptoms, then you use a matatu, you might infect whoever is in the matatu. When you come and wait in the waiting bay, you might infect the other people. So please utilize the lines that we have been given, so that if you tell us that you are suspecting and we find that probably you might be a suspect, we will come for you so that we minimize this. So you don't need a face mask if you are not a health worker or you have not been advised by a health worker. For those stockpiling sanitizers, this is a communal affair. Even if you protect yourself with everything in this world and everybody around you is infected, I can assure you, you will be infected too. This is a communal affair. If you bought your 20 sanitizers, please distribute them to your neighbors who do not have. Because if they get the infection, you will surely get infected. This is a communal affair. Whenever you go anywhere and you find that they are not taking these measures, please advise those people that they need to take these measures. If you go to church and they are not hand washing or using sanitizers, please be the ambassador and be the one to inform them that as a community we must change. We must be able to accommodate these changes so that together we mitigate this. Because it's a communal affair, it's a joint affair, we must come together in solidarity for us to be able to defeat and to slow the spread of coronavirus. So I think I'll give, okay. Then I think we can take questions.